Hello, everyone. Welcome, and thank you for joining us on Facebook Live for our new weekly live chat, where we'll discuss and learn about all things lifestyle and health together. We're excited to kick off the series with a look at relationships. We hope you'll leave this discussion with your questions answered, if you have any, plus some sound relationship advice and practical tips to apply to your own life, especially during this hard time of COVID-19. My guest, family therapist Laura Heck, and I will share some insights. Then we'll answer all of your questions. Please type any questions you have into the comment section, and we'll do our best to answer as many as we can. After this webinar, if you have additional questions, please feel free to reach out to us in many ways. We have our COVID hotline, which you can call toll-free at 844-258-1820, or email us at COVID-19, that's COVID, COVID-19 at EHE.health. If you've had an EHE preventive exam, you're also eligible to speak to our health mentor team, who are specially trained to help you achieve your goals by emailing mentorme at EHE.health. That's MENTORME at EHE.health. We also have a COVID health portal with additional information at COVID19.EHE.health. We look forward to hearing from you all soon. My name is Dr. Seema Sarin. I'm the Assistant Medical Director and Director of Lifestyle Medicine here at EHE Health. I'm board certified in both lifestyle medicine and internal medicine, and completed my training at George Washington and Johns Hopkins Universities. I've been working with patients for more than 15 years now as a primary urgent care and preventive provider, and I lead our health mentorship program at EHE, which focuses on how to tailor your lifestyle habits to promote better health and reduce risk factors for chronic disease. We concentrate on partnering with every person to see and help them meet their health goals, including optimizing how they eat, think, and move. It's my pleasure also to introduce you to Laura Heck. She's a licensed marriage and family therapist and a certified Gottman therapist with a virtual private practice working exclusively with couples. Laura is the co-host of Marriage Therapy Radio, hosts the 7 Principles for Making Marriage Work, which is a workshop for adults, and coaches women through the Epic Wives Experiment. Not only that, she speaks and trains for the Gottman Institute and is a regular media expert on the topic of intimate relationships. Thank you, Laura, for joining us today.
Yeah, thank you for having me.
Great. So let's get started. Laura, as we find ourselves at home facing new challenges, perhaps spending time and all of our time with our significant others and our close family, what can we do now to make our relationships work most effectively?
Yeah, well, I mean, as you had mentioned in part of my bio and my training, I'm what's considered a Gottman certified therapist, which really means that I've been trained to think about couples in a really research and empirically validated way. So pioneers in relationship science, doctors John and Julie Gottman, have really revolutionized our understanding of marriage, relationships, and couples therapy. So they're really drawing on more than 4 decades of research with over 4,000 couples. And from that information, they constructed a theory. It's called the Sound Relationship House Theory. And it's really the culmination of all of that research, which uses a practical approach to help couples break through barriers to achieve greater understanding, connection, and intimacy in relationships. So just to summarize and let you all know what that sound relationship house is, it really can be captured in 3 distinct ways. So if you were to imagine a house, you have the foundation of that house, and that foundation is really the strength of your relationship, which is friendship. And there's 3 ways to really think about your friendship. It's I know you, I like you, and I've got your back. And so it seems intuitive that friendship would be necessary for a healthy relationship. And I find that it is oftentimes really strong when we first start dating. But over time, especially in stressful times like what we're experiencing right now, that friendship can become eroded over time. I hear a lot of couples in my practice say, I like you. sometimes I love you, I'm committed to you, but sometimes I don't like you. And I think that that is a part of the friendship and that foundation of that house. So you have that house, the foundation is friendship, and then the next level up is going to be all about conflict management and how we talk through difficult topics, and also how do we manage stress in the relationship and tension that comes up. Dr. Gottman found that it's really not the absence of conflict that makes a healthy relationship. It's really more about how do we navigate conflict in a really healthy way, which is really all about skill building. I don't think that we know that intuitively about how to manage conflict effectively. So
can you give us an example, like a real life practical example of a good way to resolve conflict?
Yeah, absolutely. I mean, there really are a lot of skills that we can learn, like how and when do we address conflict with our partner? And we want to make sure that we're bringing it up really gently. So research shows that how you initially address conflict with your partner, 94% of the time, that's how that conversation is going to follow suit. So if you are gentle and you are not critical, that conversation is likely going to go really well. So we want to be really cognizant and mindful of the way that we're addressing conflict initially with our partner. So that's just one skill that we can build. So then we have our sound relationship house, we have our friendship foundation, then we have conflict, and then the top of the house is going to be all about how do you create a really meaningful, purposeful relationship. And often this is something that we think about a little bit later in our years together. And one way that we can have a purposeful, meaningful relationship is to really focus on supporting our partner's dreams. And it's all about asking, what are your dreams and how can I be your biggest cheerleader and help you to accomplish those dreams? So I'd like to, for all of you that are watching this, just take kind of a little bit of a mindful inventory of how your sound relationship house is doing. So I'll ask questions here, just 3 questions. I want you to think on a scale of 1 to 10, where would you rate yourself? So question number 1 is, how well do you feel well known by your partner? And how do you feel well liked by your partner? 1 being low, 10 being high. This is taking a look at your friendship foundation. The second question is, how supported do you feel? How well do you navigate conflict with empathy and understanding without escalating or shutting down? On a scale of 1 to 10, how well are you doing in that area? And then the third question is, how supported do you feel in reaching your dreams? So we're just taking a look at where you're falling in that sound relationship house. So I really just have, some advice, because it can feel like there's a lot to do in order to make that relationship strong. But I want to say that the motto that we follow at the Gottman Institute is it's really small things often. And it's the small, consistent efforts that you put into your relationship that have the biggest impact over time. So hopefully I haven't overwhelmed you thinking you have to take on the whole house, but rather just making small repairs here and there on a consistent basis.
That was an excellent overview, and I think that those specific examples and those questions that you're asking really help us kind of self-reflect and kind of take inventory of our current relationships with our spouse or significant other. So thinking about our other relationships within the family too, like children, close friends of any age, and older adults. I want to talk a little bit about how we optimize those relationships as well during this time, especially as they may be leaning on us more. Maintaining friendships, working towards shared goals, and mastering this conflict resolution are vital to relationship health. But the thing is as we grow up, we're trained throughout our lives in elementary school and high school and college beyond. If we decide to go for further education, we learn about math and science and politics and English, even physical exercise through PE, my kid's favorite class. But we don't learn how to promote, nurture, and maintain healthy relationships but they're so vital. Not only are they vital and enjoyable for their own sake, but they're also important for a lot of other reasons too. As a physician, physical health is always at top of mind, and studies have shown strong family and community relationships have far-reaching effects into improved physical health, emotional health, as well as even brain health, and can improve things like cardiovascular disease risk, blood pressure. It can even prolong our lives. Not only that, it makes it easier for your family and loved ones to be able to solve problems and resolve conflict. And when you have children in your family, and younger adults even more so, it teaches them the skills they need to build healthy relationships of their own. So you model those behaviors for others. It helps you respect differences of opinion as well, and help build that emotional intelligence and emotional IQ levels. So I know, as family members and friends, we're all doing the best we can. We find ourselves juggling work, friends, household management, spouses at home, and even more. But even with the busiest of people, there are many things that we can do to develop and support good family and close relationships. Definitely strong families continue to grow from love and security, communication and connection, as well as a few rules and routines too. So during the discussion portion, what I'll do is we'll discuss some of these items on how to best foster these relationships. So what I'd like to do is I'd like to take it to the Facebook Live questions. Please feel free to put in your questions at our streaming platform, and then we'll do our best to answer these questions. So I see a few have come in already. Let me look at here. So the first question is for you, Laura. It's, how can I ask for space or time by myself?
Yeah, we're sort of on top of each other right now. There's a lot of we-ness happening, and which seems to be like the flip, because a lot of my time before COVID was spent trying to get people to spend quality time with one another. And now it's trying to get people to take some space from one another. Especially, I'm an introvert, and that time and that space spent in solitude is really important and helps to recharge me. So I actually think that it needs to be ritualized. And with small children, we are really good about making sure that kids are taking time to rest in the middle of the day. If you have toddlers at home, that time where they're shutting down is important. We need that time to shut down as well. And I think that if the family can ritualize time that they can honor for one another, and I love sitting down on a Sunday evening and looking at the week in advance and saying, okay, let's look at Monday. This is when I'm going to work out. This is when I'm going to take some time and maybe have a bubble bath, or I'm going to go to my sacred space. And that's maybe an hour a day, but it's just a conversation that you're going to have in advance, so that you're not just darting off and saying, leave me alone, I need to be alone. But it's more of an agreement that you can honor for one another. And I think as long as we are addressing it with our partner through conversation ahead of time, we're doing a good job about it.
I love that idea. Just like, in our work lives, we may say, hey, we're going to take this vacation time, or let's plan on this meeting. You're doing the same thing for your own personal needs and desires as well. That's a great advice. Excellent. So our next question here is what is quality time with the family, and what are some examples of this? So yeah, that's a great question. I think I'll take a stab at this one. So there's several ways we can make quality time happen, and it doesn't have to be an extended period of time. Especially during this time, we may be spending a lot of time with our families, but we still have other responsibilities that we want to make sure that we're taking care of. So, using the time that we have optimally. So making quality time happen is taking a moment together to talk and share a laugh. Maybe you found an interesting meme or a funny sign on an email that you got. Something that can just lighten the mood and create those positive feelings is important. Making sure you have one-on-one chats with each family member, whether it be your spouse, your children, maybe a grandparent or a parent or aunt or uncle living with you as well. And as you were talking about before, Laura, as well, setting aside time not only for yourself, but with your partner. And then you want to do fun, regular things as a family to build those connections. So whether it's just to take a walk around the neighborhood, do a family board game, or if you have older children, maybe a family movie night and a discussion afterwards are always great ways to build that quality time. So you have the unwind time as well, where you're unwinding together as a group. Another great way is to make decisions together. So planning out events in the future. So what to do for special events like birthdays or Friday night. We go out to dinner every Friday night. Where should we go? And even young children can be part of those decisions. The other thing is, to really think about communication skills, like positive communication. So some ideas are stop what you're doing and listen with full attention. So oftentimes, maybe during the day, you can say, hey, I'm going to be working from 8 to 10. I have a 5-minute break in between. But really stop, listen, look into their eyes, and talk about things. And be open about talking about difficult things like admitting to mistakes, complex and hard feelings like anger, frustration, fear, anxiety, especially during this time. It's important for our children and family members to understand that this is a hard time for everyone, and you can model how you deal with the situation and the information at hand. And you want to ensure appreciation, not only verbally saying I love you, to your children, your spouse, your family every night, but you want to do this through nonverbal communication skills as well. For example, hugs, kisses, eye contact. It sends the message that you want to be close to your child, and it's something that goes a long way. But as the old saying goes, actions speak louder than words. So those are some of the actionable things that you can do, both verbal and nonverbal, to kind of build that quality time and to build the communication skills. So another great question somebody asked, Laura, if you could answer this one. What would a good way to start a hard conversation be? And give a couple of examples.
Yeah, sure. So if you have something that you really find important that you want to talk to your partner about, you're anticipating it's not going to go well, or it's going to be difficult, I always recommend that, number one, you first start with you and identifying what is it that I want to communicate, what is it that I want. So you're entering that conversation in a really mindful way. Before you do that, though, get the buy-in from your partner. And that starts by saying this phrase: honey, there's something really important I want to talk to you about. Is now a good time? And so if it's not a good time, the response that I'd like is, now's not a great time, but I will be wrapping up with what I'm doing. Why don't we sit down after we put the kids to bed and we can talk about this? So you're getting your partner's buy-in, and they're bought into what you want to say, and they've given you permission to have that conversation with them. And then there's a formula that I would like for you to use. It's called the gentle startup formula. So that's entering into that conversation in a gentle way. And the formula is starting with I feel. So you're going to be checking in with yourself and identifying your feeling. And I think too often we start by talking about our thoughts. And you'll know you're slipping into talking about your thoughts when you say, I feel like you aren't paying enough attention to me. That's not a gentle startup. But instead you could say, I feel lonely, or I feel disengaged or disconnected. And so that's the first part of this formula. I feel, and then about. So you're going to be describing the situation in as non-judgmental way as possible. So I'm feeling lonely. We are spending all this time together as a family, but I really miss our date nights where we had time by ourselves. And the third part of the formula is to ask for what you need very clearly. And I'd really love it if we could plan a special date night at home after the kids go to bed. So just to summarize, asking for permission. So now is a good time to talk. If not, when would be? And then you're going to say, I feel, about, and I need. So that's how you enter a conversation really gently.
Oh, great. I love that advice, and I love the way you frame it, because it makes me lean in and want to help and figure out ways that I can help you feeling that way, my partner or significant other. That is excellent. Great.
Yeah.
So the next question there is, my son is almost 6 and doesn't listen to us. I hate repeating myself constantly, and I end up yelling, and he hates when we yell, but he just doesn't listen. He's been hiding items around the house, like my keys, and my husband and I feel like we're losing it. What can we do? That's a great real world example. And definitely, if you've had young kids, we've all, kind of been through something similar where, that it's difficult depending on the age, particularly with children, under 6 and below, under 8, depending, under 10. I've got a 14-year-old with the same kind of thing sometimes. But there's several things that we can do, building upon what I was talking about before about positive communication is before you're yelling, developing those bonds of communication, those positive memories, the positive interactions, and then talking about those things before they arise. So in the moment when you're yelling, it may not be the most ideal time to address how you're feeling. So talk to your son when he's calm in the, maybe sometime where he's resting, you're getting ready to make dinner, he's helping you maybe wash some vegetables or something like that. And just, sit and talk to him and say, hey, sometimes I feel like when we're talking, you're not listening. And what are some ways that would make it easier for you for us to listen, to have the conversation with each other. So that way he's recognizing, you're bringing to the attention that the issue is that, I don't want to yell, I want you to speak with me, and you don't want to repeat yourself. So what is a good plan? Maybe I count to 3 and or count to 10, and I tell you, hey, in 10 seconds, maybe not in 10 seconds, maybe in 2 minutes, and set the timer, I'm going to come and talk to you and ask you to do X. Or I expect you at this time in 10 seconds to get your clothes ready and come downstairs. Those are types of things that you can do, concrete ways that you can help him listen. And also sending out family rules. So that's really important as well, to set up family rules. So this is the way we want to treat each other. This is the way we want to speak to each other. We want to minimize yelling, for example. We treat each other with respect. We always take time when someone's talking to us to respond back. Those are some things to think about. And then also with the case of, hiding your keys, what is it that the child is trying to do? Does he not want you to leave? And that's the reason why he's hiding. Does he want attention? What is the underlying issue that, or the way that he's verbalizing it may not be the most ideal, but what is, through his actions, what is he trying to tell you? So looking at it kind of from that perspective can really help you understand and then create that space to be able to communicate effectively so you don't end up yelling as much in the future. Great. So we have another question here. Is there a recommended approach for speaking to teenagers? I try to educate my son on everything COVID, but he doesn't think he'll get it or care if he does. Is there a way to communicate with him during his rebellious phase? Absolutely. That's another wonderful question. Definitely having a teenager of my own, having patience and definitely going through education about this as well. So a recommended approach to speaking with teenagers. They're a special group, I think, because they also need time to process. They need a time to differentiate from their parents as well. They're looking to establish independence, and we want to give them the space and time to do so. Directing them to certain resources. The CDC is a great website to go to for true scientific evidence-based information that they can digest depending on their age, but it's written towards, about an 8th grade level of writing. So that would be a great idea on where to start for COVID. There's some great movies and things like that you can watch together to educate on COVID, websites and different videos you can use. But the thing is about safety and having that conversation with your son about safety when you're not arguing, when he's ready to talk, and being there for him when he's ready to talk. Sometimes they may not be ready until 10 o'clock on a Wednesday night when you have a meeting at 6 a.m. the next morning. But it's important to take those periods of time when they're ready and willing to talk with you, where it's a different type of relationship as they get older. And then you capitalize on that time to talk to him about important things like COVID and how to keep him safe. For example, hand washing, proper social distancing, and why it's so important to keep him safe, keep his friends safe, and also keep the community safe as well. So that was also a very great question. I see it's 4:33. Unfortunately, our time together has come to an end, but I want to keep the conversation going. You know, it's been a pleasure speaking with you all today. Thank you, Laura, for joining us and talking to us about relationships.
You're
This
welcome.
webcast, oh yes, awesome. This webcast will be available through your registration link. And then after this webinar, if you have any questions, let's continue this conversation. Please feel free to reach out to us via our COVID hotline. You can call toll free at 844-258-1820. That's 844-258-1820. Or email us at covid-19@ehe.health. If you had an EHE exam, you can also email mentorme at ehe.health, what I mentioned earlier, to speak to our health mentors to help you formulate a tailored plan to optimize your stress, optimize your health, reduce your stress, eat well, and nutrition, optimize your sleep. We also have a COVID health portal with additional information at covid19.ehe.health. Also, be sure to follow us on Facebook, LinkedIn, and Instagram for additional content. Again, my name is Dr. Seema Sarin. It's been a pleasure speaking with you all today. Until next time, stay safe, be well, and take care.